Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Hello, welcome back. This is Living Pain-Free. I'm Dr. Thomas Grove. Dr. Darrow's away from us here this weekend. We're going to the second half of the show here where we're talking about your orthopedic injuries, your regenerative medicine needs, right? We're talking about using things like platelets, stem cells, the healing cells of the body, how we can use those as a tool to heal tissue instead of going to the operating room. Again, using things like platelets and stem cells can be a great option for you to not only speed up your recovery, but hopefully avoid having to go and have an unnecessary surgery, right? Again, nowadays we find the culture's changing. We're finding some good long-term studies now looking at these elective orthopedic surgeries, meaning the ones that you don't need to have, right? Certainly car accident, bone sticking out, got to have surgery for something like that. What we're talking about are your elective procedures. Examples there are going to be things like, your joint replacements, your rotator cuff tears, maybe you have a partial tear of a ligament or a tendon. And we're finding now that some of these surgeries just have, poor complication rates. Sometimes it takes a longer time to heal. More importantly, it's expensive, right? You're thinking about the surgery itself. You're thinking about the physical therapy you might need. What we'd rather do is use the healing cells of the body, right? Use the platelets, use the stem cells, use ultrasound guidance, use an imaging tool where we can guide that needle in a safe way, introduce those healing cells into this area, get some healing going for you, right? Could be one round, could be a couple of rounds. We've got a great success rate. Put you in a position to heal without having to undergo those complication rates of surgery, right? Would love to talk to you live here in the studio. If it's you, a loved one, anybody that you know, you want to get a little advice of what's going on, we'd love to chat with you live here in the studio. Our number to call us is 866-870-5752. That's 866-870-5752. We'll give you a copy of Dr. Darrow's book, Stem Cell Platelet Therapy, Regenerate, Don't Operate. Great place to start. Lots of great studies. There are hundreds of studies that you can check out. Good examples in there. And again, we can give you a free consultation with our staff over the phone, not with Dr. Darrow and I, but with our staff. Our number is 800-300-9300. That's 800-300-9300. If you have no idea what regenerative medicine is and you just want to have a good place to start, what this stuff's about, what do these procedures look like, again, get a little more information about us. Our website is a fantastic place to start. That's www.jointrehab.com. That's www.jointrehab.com. Great studies on that site. You could really dive deep into the specifics. Again, I love nerding out with my patients. Hey, did you see this study? Hey, what about this thing? I'm always on the lookout for what the latest and greatest is. It's a very, very exciting time to be in regenerative medicine. Again, I'm so fortunate that, there's individuals like Dr. Darrow out there that were pioneers in the field, right? He's one of the first guys to use things like prolotherapy, right? Sugar water, to help heal tissue, and put regenerative medicine on the map. And now we've got, advanced techniques with ultrasound. Then we found out about PRP, now stem cells. So it's a very, very exciting time. We've got not only great studies behind it, right, but now we have a whole new set of tools that we can use at our disposal that I'm so fortunate. I'm so blessed. I had a little athletic ability. I ended up playing football at the University of Nebraska, which really gave me a lot of great opportunities and a lot of great mentors. From there, I got into strength and conditioning. I was traveling. I think it was over 50 countries now professionally, living with pro athletes, doing their cooking, all their training. I'm saying, what are the top guys? What are these guys doing in terms of their nutrition, right? What is their mindset? What sort of medical care are they getting? There's just so many different ways to treat the human body. And I'm always fascinated by, what's the least invasive? What's the most efficient? What's the most affordable that we can do for the patient to put them in a position where they can get the best results, right? On one end, you've got your multi-million-dollar professional athlete, and they're, just chomping at the bit to get back on the field. On the other side of things, right? I'm not treating only professional athletes, certainly, right? We treat patients of all ages, right? Whether you're the college athlete trying to keep your scholarship, you're the weekend warrior, you're somebody who requires to use their body for their job, right? And more importantly, you're somebody who wants to move their body again, right? So the role that I'm playing, we do some injections, we're physicians, but really what we're trying to do is put you in a position where you can live a full life, right? The body is meant to move. I tell patients every week, after they tell me, I'm not an athlete, but I had this injury, I say, hey, listen, man, if you're human, you're walking around on planet Earth, you are an athlete, your body is designed to move, and we want to play a role in that, right? We don't want to have pain and discomfort be a limiting factor, so you can go out and put good out in the world, right? Get back to your job. And obviously we work in the world of sports medicine. So sports is a common thing that people do. But again, a lot of people, you need your body, you need your mind to work in order to care for the loved ones around you, to be productive at your job. So it's a very, very fun role to play in people's lives. I do feel incredibly, incredibly lucky to help play that role. I can't say I can do that for everybody, but I try my best, right? We have a fantastic staff. I would say it's a really great healing environment. It's a very positive environment when you come in. Where, again, I'm not really pushing any sort of narrative, not really pushing any sort of treatment. Really what my job is at the end of the day, it's being an educator, right? I want to make sure I'm putting you in the position where you have the necessary information to make an educated decision. So in order to do that, I really wanted to dive deep into what are all the different ways that you can heal the human body, which takes a very long time. I traveled the world. Again, medical school was definitely a big challenge. Again, even with the medical school, really going after all the hard rotations, being in the ICU, being in the operating room, finding what are the non-operative, right? Things outside the operating room versus the operative in the operating room. What are the different ways to treat the human body? So you can take all that information and I can share that with you, right? So if you come in and you're considering a surgery, it's a very common occurrence where someone gets a consultation for surgery. And unfortunately, it was a very fast appointment. That's just a very unfortunate reality that we have in our culture is, if you're a surgeon nowadays, gosh, bless these guys. They a lot of times have to see so many patients every day in their clinic, which lends itself to being, a little incomplete, right? Sometimes if you're rushed through that visit, it is hard to talk about, all the options, complications, what are the actual procedures entail. And when they come to me, they say, hey, listen, it was like 5 minutes. I barely got to get a word in. I didn't really know what the surgery was going to be about. And that can be a very, very frustrating situation. And I'm so blessed that I have the opportunity where I'm not feeling rushed in the clinic, right? I don't have 5 minutes with a patient. I give you all the time in the world that we need. Again, we make sure that we keep ourselves available. I give my cell phone to every patient. And like we said, the email on our website, you can email us at any time. We'll get back to you. That's our website at www.jointrehab.com. But the reason we do that is because this system can be very frustrating for patients. We want to make sure that we're putting you in a position where you feel like you have enough information to make an educated decision. It's no different than me teaching the medical schools. I'm just laying out what your options are, having the experience, obviously, in the operating room, having the experience as a team physician for over, 8 years at the Division I level, just seeing thousands and thousands of patients, trying to put you in a position where you can make an educated decision, right? Never a great option to feel like you're pressured and rushed into making a very big decision about your health. And surgery is definitely one of those when we're looking at things like, spine surgery with their complication rates, or we're looking at things like joint replacements. Those are big surgeries. Those are big commitments. Once you have those sort of procedures done, you can't just go backwards, right? So we want to make sure that if you're going to have something like that done, you're feeling good about it, right? You've exhausted all the conservative options, right? Obviously, we're one of those conservative options using regenerative medicine, those platelets and stem cells that we can use to help heal that body and hopefully control your symptoms enough where you don't have to go underneath the knife. But it can be a very confusing landscape out there, especially if you don't have medical training, and you're trying to maybe read your imaging study. It's a foreign language, so we want to make sure we can play a role in help translating some of that information and give you your options in a very easy to understand manner. So it's a really fun opportunity that we have to help people. And everybody wants to get better, right? It's another fun part about my job is everyone's trying to get back, whether it's, your daily walks or you're a pro athlete or you're needing your body to go to work. It's a very, very satisfying job for me that I can, help provide information and hopefully get you some help healing. So let me give that phone number out another time here, guys. Again, number to call us live in the studio. We can chat about your injuries or loved one injuries. If you're driving, be safe, pull over and give us a call. Use a fake name if you need to. We're pretty friendly over here. Our number is 866-870-5752. That's 870-5752. We'll give you a copy of our book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Hundreds of studies, great case studies in there where you can educate yourself a little bit about what regenerative medicine is. You can also check out our website, even more information, even more studies, videos of us doing these procedures, spot on every single page. Just shoot us an email so we can put you in a position to get some good information, some good education, and see if regenerative medicine is a good option for you. That's www.jointrehab.com. That's www.jointrehab.com. Looks like we've got a caller coming in. Brent, I see you're in LA. How are you, sir? This is Dr. Thomas Grove. What can you help you out with today?
Yeah, hi, Dr. Grove. Well, I'm a senior citizen who on occasion gets knee pains while hiking in the Santa Monica Mountains. But I don't have significant knee pain problems, but I'm concerned that the knees might be degenerating. And can stem cell injections be used prophylactically to prevent future degeneration, or is it premature to get injections prior to an obvious problem?
Yeah, so have you had any imaging or seen a physician or anything first?
No, it hasn't been that bad. And, a lot of my doctors, I don't know how much I would trust them with these issues, but I don't know if stem cells can be used before an actual problem.
Yeah, so when you're having any sort of discomfort or any part of the body, the first question is, where is it coming from, right? How old are you, Brent?
I'm over 70.
Yeah, so if you're in your 70s, statistically, you probably have a little arthritis, right, within the joints. You probably have some degenerative meniscus tears. Are you a pretty active guy?
Yes, I am.
Yeah, so if I brought you into the clinic and put the ultrasound on you, it wouldn't surprise me at all. Actually, it would surprise me if you didn't have those things. So these are just such common findings that we see. And so the first, issue is going to be lining up, where do we think the problem's coming from? But yeah, I point to the studies on this one. When people ask me questions like this, you can see what high quality concentrated PRP and what stem cells can do for tissue. So trying to figure out if that's a good option for you, I always think about, what do we think the mechanism of how these cells work, right? So again, hypothetically, let's just say it's arthritis that's causing your pain. So arthritis, what is it? We've got cartilage between the joints, right? We've got a little bit of, gliding that happens, and that cartilage, when it gets worn out, can cause severe discomfort for people, especially the more advanced that it is. And, what are the options there? So let's go to one end, right? We do nothing. Slowly, things are probably going to continue to wear themselves out, right? We think a lot of the cases of arthritis are degenerative, meaning, just regular wear and tear. Things wear out over time, right? You can't drive in the same pair of tires the whole time. Sometimes you got to swap those tires out. And so one end of it is basically do nothing, right? The furthest end on the opposite side is we remove the problem by doing a joint replacement. Now, obviously, we want to try to avoid an invasive surgery like that. So where are we at in between? All right. So we can do injection therapy with things like steroids or with numbing medication, which can provide you temporary relief. But again, I'll point to the studies on this one. And if you don't believe me, check it out. Just Google, cartilage damage and steroids. We know now that these substances can actually kill off and degrade that good, healthy articular cartilage within the joint. So we really don't like doing steroids nowadays. Same thing with high doses of numbing medication. That can also be toxic to tissues, right? So might give you a false sense that you feel better because you're having less pain, but in the long term, man, we really want to avoid that. It's a pretty common scenario where someone comes in. I had a gentleman the other day. He had 10 steroid injections in the last couple of years, and his joints are really, really worn down. As opposed to what we're doing with regenerative medicine. And so this is kind of the sweet spot. This is where we're actually regenerating tissue. And again, we've got great studies in this that we actually show that we can grow a little cartilage in there. We can actually remove some of these chronic inflammatory proteins and cytokines that we also think contribute to arthritis, which could be a kind of a chronic inflammatory condition, which is what we call cell-mediated. So some of these, quote-unquote bad cells that cause this chronic inflammation, which can speed up arthritis. And we now know that if you're actually looking at the synovial fluid or the fluid within a joint, after you have PRP and stem cells, that it's a totally different environment. So it not only regrows a little cartilage, but it creates a more optimal healing environment. So for me, that really is something that makes sense to help prevent down the line, arthritis. There's actually been some studies too that shows that it slows down the wearing down of that cartilage, or that just regular, degradation that we're going to have just by using the tissue, obviously, right? So on a couple of different ways, to me, it makes sense. That could be something to consider. But again, the first question is, where is that discomfort when you have it? Where is that coming from, right? Could be the joint. When we're looking at a knee, there are all sorts of structures around that knee that could be causing discomfort, right? It could be fluid within the joint. It could be fluid within something called a Baker's cyst, right, on the back of the knee. We've got a lot of muscles that cross that joint. So maybe it's a calf muscle, quadricep muscle, could be a hamstring muscle. And then where the muscle attaches to bone is called a tendon. So it could be a tendon issue, right, where it attaches to bone. Certainly. Could be a ligament issue. You ever heard of like an ACL before, Brent?
I've heard of it.
Yeah, so it's called the anterior cruciate ligament. That's one of multiple ligaments that help provide stability to that knee, so it kind of prevents that sort of buckling feeling. So there's a lot of different reasons why someone could have knee pain, and that's why it's really important that, again, I'd love to get some hands on you, Brent. I want to, palpate, and I want to do a physical exam, scan you with that ultrasound, and see exactly where that discomfort's coming from. Again, the big reason for that is, let's just say, hey, listen, you're committed. I want to have a regenerative medicine treatment. The next question is, where the heck do we inject this stuff, right? So that physical exam, that ultrasound will really help us out and determine where do we think we're going to place those cells, those healing cells, to put you in the best position to get the most amount of healing and keep you moving, right? So you're in your 70s. What do you like to do for physical activity?
Well, I do hiking.
You're like a hiker, yeah.
And I haven't been doing rollerblading lately, but it just, the thing is, I'm used to it being perfect, and every once in a while I go, what's that? And so I can still walk for miles, but I just don't know if something is coming on, if prophylactically I should be taking an injection.
Yeah, and again, my big goal, big picture, guys, I'm not talking about regenerative medicine. Really, that's just the tool I'm using, but my goal is I want to keep you active. I want to keep you moving, keep those muscles strong, keep that bone density, right? Not to mention all the great benefits of exercise, for your mood, right? Your mindset, your cognitive function, your metabolic function, all these great benefits that we have. And again, knee pain can be one of those things that totally just limits your ability to exercise, right? So you be a guy I'd really like to get in and make sure we can put you in a position to be successful. So really, really appreciate your call. Do you have any other areas of pain?
No, not at the moment, thank God.
Hey, lucky guy. Fantastic. Well, you're doing all the right things, but yeah, regenerative medicine could be a fantastic tool for you to utilize either now or in the future to help keep you active and keep you moving like that. So that's fantastic. Brent, thank you so much for your call and your support. Thank you, sir. But another great example here, guys, where we can talk about the benefits of regenerative medicine. Now we know so much more than we used to know, 30, 40 years ago about how this stuff works, right? These are the healing cells of the body, but it's not magic, right? We've got cells that do healing. We introduce those cells in an area that we want to regenerate some tissue. And it's no surprise that people have less pain, less discomfort. So it's a really, really fun tool to use that we can confidently keep you out of that operating room compared to, again, invasive surgery or doing nothing, and that problem just slowly gets worse and worse over time. So when I get callers like that, I get really excited. A guy in their 70s, and he's out there still hiking, still moving his body. And that's really the dream, right? So it's a pretty fun call that we have. But we got another call coming in here from Rick at Seal Beach. Rick, how are you doing? What can you help you out with today?
Well, my wife's extremely conservative. She has hip arthritis, and I've talked to Dr. Darrow, and we believe this stuff might work. But do you keep records of your patients? So, for example, my wife has been to an orthopedic surgeon, and he wants to do a hip replacement. Mm-hmm. The right hip is 2 millimeters. The left hip is 4 millimeters of cartilage left. Now, do you keep records of? She doesn't believe this will work. In that, if you come in and get all your stem cell treatments, how do you keep records of people with arthritis where the cartilage regrows?
Yeah, certainly. So to me, it's kind of irrefutable. There's so much evidence now, level one evidence.
Keep records in your own office, so people.
Oh yeah, certainly. Yep.
So if they come in and say, okay, we have this is the arthritis she has. You have to go to analysis. The doctor did a hands-on analysis, moved her around, and the issue with stem cells and PRP is it takes a while for it to work. And she had I had a cortisone shot in the hip, and it worked. One indication was if you have a shot in the hip and it makes the pain go away, that's probably where the pain is generated, right?
Correct. Yes, we call that kind of a diagnostic injection. So I'd rather just use lidocaine that's short acting. I can use something called a lidocaine test where, if we're not quite sure where that pain is, I can use a little numbing. Low dose now. Again, higher doses is toxic to tissues. Cortisone, toxic to tissues. I'd rather use a short acting numbing agent. But that gives us more information, right? So if we put it into the hip joint, someone has, an immediate decrease in pain. That's a good hint to say, hey, this is a good area that we can get some regenerative medicine into and try to regrow some of that cartilage, try to clean up some of these chronic inflammatory proteins and cytokines and create a more optimal healing environment for that hip and put you in a position to be successful. One thing I would give you a little advice on here, though, is going to be really looking at the imaging and measurements of cartilage and whatnot. So just because you have less cartilage on one side compared to the other doesn't necessarily mean a whole lot. It certainly could line up where maybe you've got more arthritis. It could cause more pain. But it's a very common finding that I have with patients where they have worse arthritis on the other side, but they have no pain whatsoever. So at the end of the day, we're treating symptoms. We're not going to be treating, a cartilage thickness measurement. We don't need a certain amount of cartilage to be pain-free, which is a metric a lot of orthopedic surgeons will use. We'll say, hey, well, if your cartilage is thinned out, there's no way that you're going to have pain relief, which is just simply not true. We certainly have cartilage that's very thinned out, that we can still get great results with patients. But yeah, like you said, there's no guarantee. It could take some time to regrow that cartilage. Certainly it could take longer than, using a steroid shot. But I'd be very, very hesitant for that steroid now. It's going to accelerate that wearing out of that tissue, which we see can fast track people to surgery because you have less and less and less cartilage. And certainly we do have patients that have true bone-on-bone arthritis. It's very rare to see those sort of patients. So most of the patients that we see are still good candidates for regenerative medicine because they're still, walking around and being functional. So is she able to still kind of bear weight and walk around and move around?
Yeah, she moves around today. The last couple of days has been more pain, probably because he also has hip bursitis. So
Sure.
It's probably a combination of hip bursitis and the arthritic pain. But she also has a groin pain now and then. But the one good thing about the doctor was he moved her around and has an angle on her how her hip moves and her everything moves. You have angle reports. So, but the issue is she's afraid that the operation will probably work, but you're not going to know if your system works for months, right? It could be months.
Potentially. Yep. Again, everyone's healing journey is different. My big takeaway point here for this conversation, Rick, you're bringing up a really good point, is that when you're kind of putting head to head, right? Should I do regenerative medicine or should I do the surgery? I mean, the benefit is if regenerative medicine, if you don't get the relief that you're looking for, you can still always have that surgery. That surgery is still waiting for you, at the end of the day, right? As opposed to regenerative medicine, if we can potentially keep you out of that operating room, that's definitely a much better option in terms of limiting the sort of complication risk that you're going to put yourself into going underneath that surgery. So to me, it's a really good option because, it's not like you can't still have that surgery if you don't have the results that you're looking for, as opposed to if you have that surgery and you have that joint replacement, it really limits how much that I can do, right? And again, if you've got somebody who has that dilemma, would love to get you into the clinic. Again, I invite you, give us a call. We'll get you scheduled to come in for an appointment. That's 800-300-9300, 800-300-9300. Everybody else who's listening, check out our website, www.jointrehab.com. That's www.jointrehab.com. Rick, thank you so much for your call. We'll see you guys next week.
You've been listening to Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff for free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Regenerate, don't operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870 The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's